Hello again, everyone. Thanks very much for joining us. It is tempting to think of diabetes in Arkansas as a ticking time bomb, but in fact, the bomb's already gone off and it continues to explode at enormous cost to the public and the private sector. There is, of course, also the personal costs: blindness, disease, kidney failure, amputation, death. The state health department calls it an epidemic. In less than 2 decades, the number of diagnosed cases or classified cases of diabetes in Arkansas rose by almost 44%. It's estimated that 372,000 adult Arkansans have diabetes, and perhaps as many as half of those are not receiving any treatment whatsoever. Arkansas, in fact, has been above the national average in diagnosed diabetes cases in each of the past 15 years. It is diabetes that brings Dan Hurley to Arkansas. And Dan Hurley, medical journalist, thanks very much for coming and to discuss your work, Diabetes Rising, how a rare, or comparatively rare, I guess, disease became a national pandemic. You're focusing on diabetes 1 and 2.
Yes.
If diabetes is not peculiar to Arkansas, if it's not restricted to Arkansas, if it is especially acute in Arkansas, it is hardly restricted to Arkansas. We're talking about a regional, indeed even a national phenomenon.
Well, by pandemic, actually, I'm talking about the whole world. It's strange to imagine that India and China, where when I was a kid in the 60s, you know, they'd say, finish your peas there. Right. They're starving in India. Now, those two countries have more people with diabetes than anywhere in the world. It's rising in Africa, everywhere around the world.